Hello, Manar. How are you doing today?
Good, I'm fine.
Thank you. My name is Suleiman. I am going to be your nursing student for today. I'm going to be assessing your physical exam. Should take no longer than 20 minutes. Prior to the assessment, I'm going to be touching all over your body. Is that okay with you?
Yeah, it's okay.
Okay. I'm going to start off with verifying your ID band. And can you please state your name and date of birth?
Manar Siriani, October 10th, 1970.
Okay, perfect. I'm going to start off with asking you a couple questions regarding orientation.
Okay.
Can you please state your name?
Manar Siriani,
Can you tell me what day it is today?
April 24th,
Can you tell me where you're at?
hospital,
And why are you here?
to do physical.
Okay, perfect. Client posture is upright. Hygiene looks appropriate and well groomed. Clothes is clean. Hair is brushed. Do you have any difficulties walking in today?
No.
Okay, and then how are you feeling today?
I'm good.
Okay, so I'm going to go ahead and observe the client's skull. The contour of the head is round and symmetrical. Hair is black and evenly distributed. So I'm going to go ahead and palpate your head. Let me know if you feel any pain or tenderness.
No.
Okay. Scalp is non-tender. Hair texture is thick. I don't see any scars or lesions and no dandruff. So now I'm going to go ahead and move on to the face. So facial feature and facial bone structure look appropriate, symmetrical, appropriate in size, intact. Skin is also intact. I don't see any scars or lesions or any deformities. So now I'm going to go ahead and have you do a couple face reactions. So I'm going to have you start off with wiggling your forehead, puffing out your cheeks, smiling, closing your eyes tight, clenching your teeth, and sticking out your tongue. Perfect. Facial reactions are symmetrical. So I'm going to go ahead and close your eyes. And I'm going to have you point at where I touch your face, okay? So go ahead and close your eyes. Okay. Point at where you feel. Okay. Facial sensitivity seems to be appropriate. So now I'm going to go ahead and move on to the face. So like I said, skin's intact, appropriate to ethnicity. I'm going to go ahead and palpate your face. Let me know if you feel any pain or tenderness.
No.
Okay. Face is non-tender, skin is smooth. Facial skin and bone structure are appropriate in size and symmetrical and intact. So now I'm going to go ahead and palpate your sinuses. Let me know if you feel any pain or tenderness.
No. No.
Okay, sinuses are non-tender. Perfect. So now I'm going to go ahead and move on to the ears, eyes. So now, as of now, I would perform the smelling and Rosenthal exam. So I'm going to go ahead and look at your eyebrows. Your eyebrows are symmetrical. They are thin. Hair distributed evenly. Skin under the eyebrows are intact. Eyelids are also intact and pink. Eyelashes are present on both an upper and bottom lid. And also patient exhibiting normal blinking. So now I'm going to go ahead and have you do this for me. Conjunctiva is pink and no discharge. Thank you. You can stop. Sclera is also white with little veins. So now I'm going to have also iris is round and brown. So I'm going to have you go ahead and do a couple eye movements. So I'm going to have you look at this and move, follow it without moving your head. Okay, and have you look at the pen and then look behind me. Okay, thank you. Now I'm going to go ahead and assess for your pupil reaction to light. So go ahead and look at me. Okay, I'm going to have you go like this for me. Okay, thank you very much. Pupils are equal, round, reactive to light with accommodation and consensual reaction. So now we're going to go ahead and move on to the ears. So I'm going to go ahead and look at your ears. Patient has 2 ears, are symmetrical, equal with outer canvas. I don't see any scars or lesions or any deformities, skin's intact, and colors appropriate to ethnicity. I'm going to go ahead and look at the external ill canal. I don't see any discharge or any lesions. So now I'm gonna go ahead and also look at the skin behind the ear where the lymph nodes are located. I don't see any edema, arrhythmia, or red streaks, which are good. So now I'm gonna go ahead and palpate the ear and the mastoid area. Let me know if you feel any pain or tenderness.
No. No.
Okay, ears and mastoid area are non-tender. So I'm gonna have you close your eyes and let me know when you hear my fingers rub. Let me know.
Yes.
Okay, cool. And also, I'm going to be doing the Weber's test. Let me know when vibrations are equal on both ends. Equal on both ends?
Yes.
Okay, perfect. Thank you. Next, I would perform an occipital exam to examine the external ear canal, any access serum, or your eardrum. Okay, so now I'm going to go ahead and move on to the nose. Skin is intact, symmetrical. I don't see any scars or lesions. Sputum is also midlined and symmetrical, so that's good. I'm gonna go ahead and have you do this for me. Patency is good. Now I'm gonna also go ahead and look into your nose. Okay. Turbinate seem to be pink, no discharge. Perfect. So now we're gonna move on to the lips. Skin looks intact, pink and moist. I'm gonna have you go ahead and open your mouth for me. Okay, looking into the patient's mouth. Patient has normal amount of teeth. Teeth are white, so good oral hygiene. Hard palate, soft palate are intact and pink. Uvula is midlined. Anterior and posterior patellars are also present in pink. So is both tonsils on both ends. They are also pink. I don't see any redness in the back of the throat. Okay, thank you. Go ahead and close them. I didn't notice any abnormal odors in your mouth. Your tongue is pink and has a surface slightly rough. So I'm going to go ahead and test for the range of motion of your tongue. So I'm going to have you stick out your tongue. Point it up, down, left, right. Okay, perfect. Good range of motion of the tongue. Next, I would palpate your gums and tongue and elicit your gag reflex.
Okay.
So now I'm going to test for TMJ. So I'm going to have you open your mouth and then close it. Okay. Positive TMJ.
Yes.
Perfect. Now we're going to move on to the neck. So I'm going to look at the neck. Neck is symmetrical. I don't see any scars or lesions. Skin's intact. Trachea is midlined. I don't see any goiters or any bulging thyroid. Trachea alignment is appropriate. So now I'm going to go ahead and do a couple motion range of motion and strength. So I'm going to have you look up, look down, to the left, and then to the right. Okay, so I'm going to have you look against my hand. Okay, and the other hand. Okay, thank you. I'm also going to have you shrug your shoulders. Okay, range of motion and strength are appropriate and good. So now I'm going to go ahead and check for your carotid pulse.
Okay.
Present about a +2. Okay, present about a +2. So now I'm going to go ahead and palpate your lymph nodes around your head and neck.
Okay.
So let me know if you feel any pain or tenderness. Okay, so your occipital lymph nodes.
No.
Subclavicular lymph nodes. No. Sublingual. No. Submental. Do you feel any pain or tenderness?
No.
Okay. Lymph nodes are non-tender and non-palpable. So now I'm going to go ahead and have you lay down here a little bit. Not all the way down, just lay down like this. And I'm going to test for jugular venous distension. Okay. Negative jugular venous distension. Thank you very much. Okay. So now we're going to go ahead and move on to the upper extremities. I'm going to go ahead and start off with your arms. So I'm going to take a look at your arms. Arms are symmetrical. I don't see any scars or lesions or any deformities. Skin's intact and appropriate to ethnicity. I'm going to feel down your arms. Let me know if you feel any pain or tenderness, okay? Okay. Now I'm going to test for temperature. Temperature is normal and equal bilateral. So I'm going to go ahead and feel for a couple pulses.
Okay.
So I'm going to start off with the radial pulse. Okay, about a +2. Your brachial pulse. Okay, about a +2. And I'm also going to feel for any epitrochial lymph nodes. Let me know if you feel any pain or tenderness.
No.
Any pain or tenderness?
No.
Okay. Epitrochial nodes are non-tender and non-palpable. So now I'm going to have you do a couple range of motion tests with your arms.
Okay.
So I'm going to have you stick out your hands. Do this for me. Out. Twist your wrist. Lifting weights. Okay. Range of motion seems to be good and appropriate. So now I'm going to go ahead and test for your reflexes.
Okay.
So now I'm going to have you go ahead and relax your arm, relax your hand. Okay. Go ahead and relax it. Okay. Good brachioradialis reflex. So now I'm going to go ahead and move down to the hands. So patient has 2 hands, they are symmetrical, skin's intact, I don't see any scars or lesions or any deformities, temperatures equal, bilateral, no excess moisture. I'm going to go ahead and inspect the nails. Nails are round and clean and non-brittle. Going to check for capillary refill. Capillary refill is instant. Perfect, and now I'm going to go ahead and check for fingernail clubbing, so if you can do this for me. No fingernail clubbing. Perfect, thank you. So now we're going to go ahead and move on to the chest. So we're going to start off with the posterior chest. So if we could have you turn around a little bit, other way. Okay. So I'm going to go ahead and inspect your back. So shoulders are symmetrical, muscular development looks good, scapular alignment is right, spinal alignment is also appropriate. Muscle development looks good. I don't see any dyspnea. So I'm going to go ahead and palpate your back. Let me know if you feel any pain or tenderness.
No. No.
Okay, perfect. I'm going to have you go ahead and take a breath in and out. Okay. Thoracic expansion looks good. Okay, I'm going to go ahead and palpate your vertebrae for alignment. Vertebrae seems to be aligned. Now I'm going to go ahead and go down your back. Keep saying 99 every time I go down, okay?
99, 99, 99, 99.
Okay. Affirmative vibration equal on both sides. So I'm going to go ahead and listen to some, actually I'm going to go ahead and test percuss your kidneys. Let me know if you feel any pain or tenderness.
Okay. No.
Okay.
No.
Okay, perfect. Now I'm going to go ahead and listen to some lung sounds.
Okay.
So every time I move my stethoscope, take a breath in and out.
Okay.
Okay, I'm going to have you put your hands on top of your head and do the same thing. Go ahead and breathe. Okay, perfect. Thank you. So now we're going to move on to the anterior chest, so the front of the chest. I'm going to have you turn around. Okay. So I'm going to go ahead and assess your chest. Skin looks intact. I don't see any scars or lesions or any disformity. Don't see any dyspnea, any pulsations or heaving. I'm going to go ahead and palpate down your also muscular development looks appropriate. Everything looks symmetrical. So now I'm going to go ahead and place my hand down your chest. Keep saying 99 for me, okay?
99, 99, 99, 99.
Okay, equal affirmatives are symmetrical. So now I'm going to go ahead and listen to some breath sounds.
Okay.
Take a breath in and out every time I move my stethoscope. Okay, now I'm going to go ahead and listen to some heart sounds. Okay, so I'm going to start with aortic, pulmonic, Erb's point, tricuspid, macho. Okay. S1, S2 audible, S3, S4 non-audible, and no murmurs. So I'm going to go ahead and assess your PMI, point of maximum impulse. Present about a +2. Okay, perfect. So now we're going to go ahead and move on to the abdomen. So if I could have you lay down real quick. So now I'm going to go ahead and assess your stomach. Contour is flat. I don't see any peristalsis or pulsation. I don't see any scars or lesions or any deformities or any bulges. Skin color is appropriate to ethnicity. So now I'm going to go ahead and listen to some vowel sounds. Okay, good. Now I'm going to go ahead and listen for some bruits or venous hums.
Okay.
So, aortic, renal, iliac, and then femoral. Okay, perfect. Thank you. So now I'm going to go ahead and lightly palpate your stomach. Let me know if you feel any pain or tenderness.
No.
Okay. Stomach's non-tender. I don't feel any bulges or anything like that or masses. Next, I'm going to have you go ahead and lift up your head. I'm going to palpate around the umbilical area. Okay. Don't see any umbilical hernia. Okay, go ahead, lay down. And then next, I would also lightly palpate your inguinal area for any lymph nodes, femoral pulses, or any bulges associated with hernia. So did you have any pain lifting your head behind your neck?
No.
Okay, so negative Brzezinski. So I'm going to go ahead and have lift up your leg. Let me know if you feel any back pain or neck pain.
No.
Okay, so negative Granum sign. So now I'm going to have you go ahead and sit back up for me, or actually lay down. I'm going to move on to the lower extremities now. So I'm going to go ahead and assess your legs. Client has 2 legs. Skin's intact, symmetrical. I don't see any scars or lesions or any deformities. Hair is shaved, legs are shaved. So I'm going to go ahead and feel down your legs. Let me know if you feel any pain or tenderness.
No.
Okay, I'm going to assess for the temperature. Okay, normal and equal bilateral. I'm going to test for a couple pulses. So I'm going to start off with the Dorsalis pedis pulse. Okay, about a +2. Tibial, posterior tibial pulse, about a +2. I'm going to have you turn around on your stomach. I'm going to test for your popliteal pulse. Okay. Okay, about a +2. Perfect, about a +2. Okay, I'm going to have you go ahead and sit on the side of the bed for me, please. I'm going to test for the popliteal reflex. So I'm going to have you go ahead and relax your leg into the back. Okay, next one. Okay, patellar reflex is normal. So now I'm going to have you go ahead and stand up for me. Okay, I assessed the client. Client didn't have any difficulties from the lying to sitting. So now I'm going to have you go ahead and walk there and back for me. Okay. Client's gait seems to be normal and good. So now I'm going to have you go ahead and bend down to your toes. I'm going to feel for your spinal alignment. Spinal alignment seems appropriate and good. Perfect. So I'm going to do a couple tests. We're going to start off with the Romberg test and have you stand with your feet shoulder width apart and close your eyes. Okay. Negative Rombergs. And next I'm going to have you go ahead and stick our hands like this, close your eyes. And one by one, get your index finger and touch the tip of your nose. And then do on with the next one. Assessing for fine motor function. Perfect. Fine motor function seems to be good. We are done with your physical exam. Thank you very much, Anna.
Thank you, sir.
No problem.